we're going to be talking with Dr. Rosemary Bates, who is in studio with me today, about wellness and how we can participate in a more focused approach to our healthcare. She has a practice here in Plano in internal medicine, but she also has so much more than that. And I'm very excited to welcome you into the studio today. Welcome.
It's great to be here. Thank you for having me.
Thank you so much. So your practice is in Plano, Texas, correct?
Yes, absolutely. For the last 20 years, nearly 20 years.
That's awesome. Well, you can tell, I love your beautiful accent. So I want to go back a little bit. Tell us about where you're from and your journey to come here to the United States.
So interesting. So I'm originally from the UK. I was raised in a town about 80 miles north of London called Northampton. Although I don't actually have a real local accent because I actually went to a boarding school, which, unlike the United States, that doesn't mean I was a terrible child or anything. It was just my parents both went to a boarding school and did the same for us, thinking it was the best education. So I was well educated. I didn't actually follow the very traditional path of going, although I did very well in school, I didn't go immediately to college, but actually I did a number of different things. Ending up, actually, I came over here for a couple of months, and that was in 1986, and I never looked back.
That's great, because I was going to say people come to Texas, whether it's overseas or domestically, and they love it or they hate it. You obviously loved it.
So, and isn't that the saying is, although you weren't born a Texan, you got here as fast as you can. Is that about right?
That's about right. That's about right. Well, we're so glad that you're here. And did you have a desire to get into medicine when you were younger?
Yes. So my dad was actually my dad passed away a couple of years ago, but he was 92, so feel very blessed with that is. But yeah, he was an obstetrician and gynecologist, and I just followed him around and absolutely adored him. So. I come from a family of physicians. So, yes, I think it was something I always wanted to do, but I just sort of went the long way around doing it.
That's so cool. And so when you came over, did you go to medical school in the States then?
Yes, I actually went to college and medical school in the States. I went to medical school here in Dallas, UT Southwestern. It's a great school.
Oh, awesome. And so that's kind of fun that so you grew up with a family of physicians around you.
I did, yes.
And your dad probably wasn't present a lot because he's delivering babies.
That's exactly right. Yes.
It's Christmas dinner. I got to go.
Absolutely.
Yeah, but that's so great. That's so great. I'm sure he had a lot of amazing stories, and that you guys did too over that time, right? Bringing people into the world. That's pretty special.
Yes. And you know what? It's funny you should say that, but it was one of the rotations I loved in med school. I did it a little bit later. And so when I made my decision about what finally to do is I think that I didn't want to be maybe as absent as if I would have pursued OBGYN. So, again, general medicine has been great to me. Internal medicine is my board specialty.
That's so cool. And so, people think of internal medicine, obviously inside the body. But I think sometimes people I'd love for you to kind of define what an internal medicine doctor does, because I feel like today, and we're going to get into what you guys do at your practice, you do so much more about the mind, body, spirit, really is an all-encompassing internal health for someone. So let's talk a little bit about how did you kind of expand into outside just kind of the realms of the general practice of an internal medicine doctor?
Yeah, so internal medicine is it's general medicine for the adult, generally speaking, is anybody over 18. We're not board certified in pediatrics. And so what we do, and then I'll tell you a little bit about branching out is, so what we do everything's acute illness, the coughs and the colds, and maybe it's worse than that, abdominal pain, chest pain. We really encourage in my practice people to come in, once a year for a thorough annual with appropriate blood work, a workup, age-appropriate cancer screening, and cardiovascular screening, and then I think we go a little bit more than that. So I think that when we think about wellness and all of those things, it's not just about years, if you like, but it's about quality of life and quality of years. And I think that most of us that are treating adults now today. I think, I don't know what percentage, but sometimes I think even as high as 80% of the things that we do are most likely lifestyle related.
Absolutely. And we were talking about that before the show, is that we have, we are responsible a lot of times for the decisions that we make, whether it be diet, social activities, extracurricular activities, whether that's someone is a drinker or a smoker, impedes what our health is and quality of our health is.
Yeah, and to some extent, it's everything we put into our body. I mean, everything we put into our body. It's everything that passes our lips from a food, from a drink. It's the exercise, not just exercise, but the amount of movement. Again, the society and the way that we live now, we're sort of overscheduled. A lot of us sit in our cars for a long commute. Most of us get paid to do something that's sedentary. So again, there's no exercise. Our brains are going.
And the smartphone, addiction to our smartphone, which I'm guilty of. We're all guilty of.
We're stressed.
Yeah.
So we're making more cortisol, more epinephrine, norepinephrine. So we're on this fight or flight rush. We eat garbage a lot of the times. We're not moving. And then also, we're a product of what we listen to and who we mix with and what we do and what we think. There's those. I think it's very interesting. They say, be careful of what you think, because what you think becomes what you say. Be careful of what you say, because what you say becomes what you do.
The thoughts that you feel, whether they're positive or negative, you amplify that.
Yes.
What I love about what you're saying is, because it's so important, we have responsibility. We are part of the problem, or good or bad, the solution with our own bodies. So if you come in to your practice in Plano, what would look like for kind of a comprehensive, when you say that, come in, you're 50 years old, like for me, 50-year-old woman, come in, we're going to do this type of comprehensive. What would that look like for someone?
So one of the most important things, I learned this in medical school, and boy, I never forget this, about 90% of the time and 90% of diagnosis, you can just discover by doing a really, really thorough history. So what I would do is, when you came in, I would review, had there been any changes? We would say, had you had any surgeries? Have you been to another provider and had any more diagnoses? Has anyone in your family changed? Any deaths, any new diseases that we might have to think a little bit about whether we should be screening, any genetic component? Have you changed any of your habits? We go a little bit over diet and exercise and those things. Then I would do an exam. We'd either have done your blood work before or at the time to look at things like your thyroid and cholesterol, your vitamin D level, your blood cells, your electrolytes, kidney and liver function, and so forth. And then at 50, we would be considering things like, you'll be due for a colonoscopy. Mm-hmm. Somebody at normal risk, potentially for some people that number's even lower now. I would be making sure you had your female visit things done. Mammograms and so forth. And then we would do an EKG, and we would decide if it was appropriate to do any more detailed testing for either, and generally speaking, either cancer risks or heart attack and stroke risks.
No, that's great, because I think that's what I love about internal medicine, is that you can tell, and we're going to talk more about this after the break, but I could come see you and really, I'm getting, instead of going to 5, 6, 7, 8 doctors for each of those areas, I can come see you and we can work on that. So really a consultative approach to medicine. And then you, of course, could refer to other specialty doctors if the need rises.
Yes, absolutely. That's what we do all the time. And we do love that continuity of care.
That's awesome.
Again, we love to see you when you're sick. We don't like you having to go other places, because we know you. We know what you can and can't take. We know when you've last been treated for something. We know your tolerance for things like pain and health and wellness and those kinds of things.
Yeah, and it's sort of a comfort to the patient to have a doctor like you that you really know that is more personal in your care. I appreciate you going over that. If you're just tuning in, we are in the studio with Dr. Rosemary Bates. She has her practice in Plano. You can learn more about her at drbateswellness.com. She emphasizes prevention and patient education to encourage a healthy lifestyle. And we're going to come back and talk more with her about some ways that we can be healthy and well during the holiday season.
Your experts in business.
Welcome back to In the Know with Brian Glenn. This is Kim Francis filling in today. How can we be more involved, and why we should be more involved in our physical and mental and spiritual well-being when it comes to our health? There's a great line that a friend told me once. She said, if you're healthy, you're wealthy. Because if you're wealthy and you don't have good health, it's not going to matter, because the money doesn't go with you when you pass away. So if you have your health, you have your wealth. And for more than a decade, Dr. Bass has partnered with patients to provide comprehensive, well-focused approach to healthcare. And I would think too, welcome back to the show. I would think too that prevention goes a long way, so that when you see a patient, you can probably get quite an assessment from their health makeup and their lifestyle, and then giving encouragement and direction to how to prevent problems in the future.
Yes, I mean, you're exactly right. It was interesting. I had cause recently to look into some cancer prevention and so forth, and it was absolutely amazing to me that I read consistently over many papers that only about 5 to 10% of cancer was genetic. So and everything else was lifestyle, and it just is amazing to me. And now we know that cardiovascular disease is still in the States, probably in most Western countries, the number one killer, about 5 times more than all cancers combined, which is incredible.
Which that has a lot to do with your diet, right? When you're dealing with the heart, diabetics, exercise, your diet.
So a third of us now. A third of us now are obese. More than a third of us now are obese.
Great. And it's hard when you see kids that are. And one thing that brings a point. I'm glad you brought that up, because one of the challenges, I've done a lot of work with the homeless and a lot of work with. I had a brother that had a brain injury, so people that are on disability, and what they're asked to live on in this country for their Social Security benefits, $750 for everything is almost near impossible. So I was excited when I saw farmers markets taking food stamp cards, because I think what happens is a lot of people that they don't choose to be in that situation, but sometimes you can't help it. How can you eat better? Instead of going into Walmart and buying all the Roman noodles. But really, if you have a family, and some of our even our military families, shamefully enough, have to go visit food banks because they don't make enough money on their military salary. But teaching them how to eat better, which then goes down to the children, because it's hard for me and sad when you see these kids that are obese.
Yes, you're right. So it used to be that type 2 diabetes, which we tend to think of more as a lifestyle. It is not always.
Right.
It's certainly very genetic, but we tend to think of it as a weight and an exercise issue. Then it starts with an insulin resistance. They need more and more insulin to do the same amount of thing. So it's greatly related with obesity and so forth. So going back when I was in med school, just in the 90s, type 2 diabetes was very, very rare in children. And now it's more common than type 1, which is that is literally a testament to our lifestyle. Obesity in kids.
And you have a unique vision of being from the UK, seeing how we live in the States. And boy, couldn't we learn a lot from people in France and in the UK. There's a book, I think, Why Parisian Women Are Skinny, or the skinny women, from Paris, because they walk and they exercise. I mean, they're not sedentary at all.
I think the number one thing when you say that difference, so the food is different, but portions are very different. I think we have just taught ourselves and learned how to eat too much food.
Right.
Certainly too much food. And then we have probably incorrectly, we feel as if we don't go to a restaurant and get a loaded plate, the largest dinner plate.
We're not getting our money's worth, is what they think.
That's exactly right. Whereas they would do us a favor to cut that down.
Right.
And then we don't move anywhere. If you live, I lived in Plano for a number of years now. I live out in Lucas, but you could live on a street almost and not know your neighbors. You drive in the back alley. You drive in.
Drive into your garage, shut the door,
Absolutely.
Drive out. You're never outside.
No one's walking.
Right.
And
it's sad.
And even going to the gym for 20 minutes, it's hard to overcome, though, being sedentary for the rest of the day. 20 minutes of exercise. In Europe, everybody's walking.
Right.
Shops and restaurants and housing is all much more within walking distance.
Mm-hmm.
And they're certainly opening up these neighborhoods here. You see more and more neighbors like that here in Dallas and in the suburbs of Dallas.
Right.
Where you sort of get out and walk, but you can just don't see anybody walking.
Yeah. You also, let's talk about in your practice. You also have done have a kind of a wellness aesthetic practice as well. Let's talk a little bit about that. And I love how you have the two, and kind of your reasoning for doing that.
So yes, so really it opened around 2016. So what I did was, obviously we live in my office is in Plano, Texas, and so we have one of the fabulous things we can do in our world is, which I think Texans do very well, is really, really, really making the most of themselves.
That's a great way to put it.
So first,
we want to put on our best faces all the time.
We
literally,
and I'm here to tell you, as a transplant from the United Kingdom, is yes, people really do make the most of themselves, and sort of we do we tend to get into that's how we live. And
that's right.
Dallas does a great job of that. So obviously there was a market for it,
right?
And people you don't necessarily get the same service, the same quality everywhere. And so it's an absolute pleasure as a physician, understanding what is and isn't good and so forth, to be able to offer some of those products and services to my patients, clients that already come to me. They already trust me, which I'm blessed for that. And so to be able to offer some of these products and services that people are already doing. So yes, I bought some space very near. We have an absolutely gorgeous spa. I have a fabulous esthetician who knows what she's doing. And yeah, we love it. We love it. And there's so much we can do now without plastic surgery, without doing any of these things that's non-invasive, a little bit of body contouring. Now, you cannot replace diet, exercise, sleep, water, avoiding processed foods, cutting down the sugars.
Right.
You can't avoid any of those things. You can't replace them. But we can certainly do a little bit of fluff and puff and, get you looking and feeling fabulous.
One of the things that when we come back from the break, I want to talk about, I love that you have an age management topic section on your website. And what I love about that is that because to this exact point, that aging is a natural process, but we all want to look and feel our best, and we want to be energetic, and we want to live a full and active life as we can. So what I think that is fantastic is that you actually, I want to get into your kind of how you partner, you develop lifestyle modification programs with nutrition and optimization with hormones and other things that can help us live our best life. And I think that's key, because I know going through menopause, it's not a fun at all. And there's so much consumer confusion in the marketplace, because there's so many products. When you walk into even Central Market and Whole Foods, you're overwhelmed. You don't know what to do. So I want to talk to you about that after the break, because I think that we all want to live as our best lives, and how can we look younger and feel better as we're aging. So if you're just tuning in, we are in the studio with Dr. Rosemary Bates. I love her tagline on her website, Wellness Well Done, is so critical. And when we come back, we're going to be talking to her more about age management and what we can do to look and feel better and feel healthier and more energetic.
KEXB.
Welcome back to In the Know with Brian Glenn. This is Kim Francis filling in today. And if you're just tuning in, we are in studio with Dr. Rosemary Bates. She is an internal medicine doctor, but so much more than that. Wellness Well Done is her tagline on her website, and you can learn more at drbateswellness.com. And we were speaking about, she's from the UK, and we were talking about how lifestyle and looking at different types of cancers, that really doing studies and finding that less than 10% of cancers are genetic. And when you look at what we're doing from a lifestyle perspective, guys, in terms of our diet, exercise, mind, body, spirit, we control that. And I think it's important to recognize that. And I also love the fact that what Dr. Bates does is really helps the patient you really touch all aspects, from the actual internal medicine, wellness and prevention, aging naturally, weight loss, hormonal optimization, and allergies. So welcome back to the show. I'm just loving this topic so much.
Thank you.
I talked about age management, and one of the things that I remember, and I'm sure you've heard of Dr. Christine Northrup. I love her. She's a part of the Hay House Institute, and I listen to her once a week, her radio show. And I can't remember the name of the book, but I'm going to follow up and email it to you, because there was a gentleman she had on a couple of weeks ago that made it his life's mission to go around the world and interview people that were living past the age of 100, the centurions. And why? Why are they living that long? How are they living that long? What are they doing? And it's so much of it was exactly what you were saying. It's their lifestyle, what they're allowing into their world. They don't even, I think a majority of them didn't even have a cell phone. So this age management is a big deal. And I think it's a big money maker. You see all kinds of ads all the time for, let's help you feel better as you're aging. But what I love about you is that you do it from the standpoint of a comprehensive evaluation with your blood and your measurements and what your indicators are of aging. Let's talk about what you've learned about age management and how you can help people when they want to realize that, hey, how can I I know it's coming, it's going to happen naturally, but how can I attack it a little bit better than I have been?
Well, and maybe I should start out by saying, aging is a privilege actually not afforded to everybody. When you think about that, we are blessed if we get to age. So as you said, so aging is inevitable, but how we age, how we feel as we age, and how we look as we age that's a variable, right? We're all going to age. If we're blessed enough to age, it's going to happen, right? Death and taxes. But there's a lot we can do. So when you think of age management, for instance, as we get older, just say in our blood and our bodies, a lot of the things that are healthy tend to go down. Think about our thyroid, our thyroid function and so forth. And then some of the things that are bad for us tend to go up, like our sort of risk of diabetes and so forth is. So we think of aging basically as oxidation. Think about when you cut an apple and then you split it apart, it tends to go brown. That's an oxidation. Methylation, which is some changes in the DNA, which lead to then some natural growth. Glycation, which basically is too much sugar, and methylation. So we think about those things, and inflammation. So all of those things are bad. And when you think about actually disease, aging, and death, you think about those four things. And there's a lot that we can change, like you said, appropriately with lifestyle. So our diet, with trying to avoid things like processed food and sugar, simple sugars. Exercise, moving. I mean, exercise is good for everything. It's good even for our risk of depression and dementia and our mood.
And something I want to ask you, because I think that especially when you look at, Christmas time and then, January, everybody's, my goodness, you see the Nutrisystems and Slim Fast and Weight Watchers, all that stuff starting up because everyone wants the quick fix. But I think it's important, and I was guilty of this at one point, even if you walked 15 to 20 minutes a day, if you were doing it consistently 3 or 4 days a week, I think the benefits of that are tremendous, as opposed to people, they get in there and they want to do too much too fast. They're too sore, they're too tired, and they don't ease into it. So that's true. You really want to try to do it, but do it reasonably as you're starting out.
And maintenance, right. So another thing you said is actually, and if you would just say, talking about weight, you cannot out-exercise a poor diet. If you need to or want to lose weight, it's actually probably 80% of it is diet.
Okay.
And so we were going back to, on the aging thing, and we said diet, exercise, and you mentioned some of these small pockets of people, these blue areas that tend to live longer. Well, one of the things they found out, a lot of their diet is sort of more like the Mediterranean and things that are high in omega-3 fish oils.
Okay.
So omega-3.
And nuts.
Yes.
Beans.
Nuts, grains, legumes.
Grains, right.
Olive oil, tomato and tomato products.
Mm-hmm.
The colorful fruits, the phyto and the phytonutrients. There's many, many things that we know. There's so many things that we can do. So, and then the last thing on the age management, the four-pronged thing is hormones just as appropriate. So hormone modulation. So should some people take hormones after they stop making them? Yes. I mean, it's a choice. We do a lot of hormone, I would say, optimization, and then getting all these things in balance. Balance is another huge thing. So again, we think of all of those things for age management. And all of those things together tend to modulate the inflammation, the oxidation, the methylation, and some of those things that we think of as being pro-aging. And again, there's a lot that we can do with our lifestyle.
As we transition, when we're talking about aging, we were talking about the med spa, because you see so many more of them coming up. I can totally get why you did this now, because I can see just in this, time we've had together, the type of person you are. You make someone feel comfortable. And if you're going to look into those things anyway, why not do it with a doctor that you've built this great relationship with, who knows you probably better than you know yourself medically, but then can help advise you and direct you on services like cool sculpting and Juvederm and laser hair removal and all these types of things. So it makes total sense that you would then open your wellness spa.
So, and I think a lot of us, ultimately we want to be healthy from the inside out. But I do think that makes a difference. And there's lots of different studies that actually show how you look, or interesting, how you perceive that you look. So think about that one. It's not even just how you definitely look to someone else, but how you perceive that you look. If you think that you look good, and you most certainly you do, but you feel good, and
right.
then you're more healthy, you're more positive, less stressed. You accomplish more. I mean, you tend to, it gives you some, I guess, power isn't necessarily the right word, but the confidence, the ability to do things. You come across differently when you feel that you look good and you look good.
when you have, and we were talking about this, what we feed our brains, right? And who we hang with, what we who you
listen
ingest, what we listen to,
you read,
right? And so all of that creates that kind of mind, body, health, spirit. And when you have good days and bad days, when you feel good about yourself. But of course, as you said, living in Dallas, if you've ever been in Fort Worth, a little bit different between the Dallas and Fort Worth communities. But Dallas, we Collin County, people, like you said, you put it so eloquently, these types of services are very important. There's a lot that's you've got on here. You have acne therapy, hydrofacial is great, and then it's called Skin Tight, TYTE. You're Forever Young, cool sculpting, Juvederm, and then of course Botox that you do.
Yeah, so we do all of those, and I have an esthetician who's extremely experienced. She's absolutely fabulous, Shelley, and so she. What we like to do is we like to have you come in. We do a free consultation. And the thing is, what is it that you are most concerned with? One of the best questions to somebody is, what is it? I mean, to some extent, I do this on a medical standpoint in the internal medicine practice as well, is what is it that's bothering you? What are you most concerned about?
Right.
And that's exactly the same with aesthetics. You might find for somebody, it might be a wrinkle, and for somebody else, it might be a little bit, especially if you're at a decent weight and so forth. You've already been working on your diet and exercise, but then you're going to find
something bothers you, you're just not getting rid of it.
Exactly. That's exactly right. And hey, things change when we get older, and so it's an absolute privilege and a pleasure to be able to really do that little bit extra, so people really, really do look good and feel great about themselves. They do better. They're better, and they're healthier.
Yeah, it's fantastic. Before we go to break, I want to let everyone know you're located on Stonewood Drive, 6300 Stonewood Drive, Suite 110 in Plano, Texas. And you basically have the Bates Wellness and Aesthetic Center. And is that in an adjacency to your internal medicine practice?
So that's in Suite 110, and then in Suite 302, right together across the car park, is our internal medicine office in Suite 302. And essentially, that's the northwest corner of Spring Creek and Coit. Stonewood Drive is a little down there. Yeah, come and see us. We would love to see you and, make you feel great, look good from the inside out.
Oh, that's fantastic. Well, we're going to be right back, and we've got another segment with Dr. Bates. And I definitely encourage you to look at her site. We'll be right back.
From Wall Street to North Texas, this is 620 AM. KEXB.
Welcome back to In the Know with Brian Glenn. This is Kim Francis filling in today, and I have just loved this last hour, we are in studio with Dr. Rosemary Bates, who is an internal medicine doctor, but also just so much more. Basically, I am going to be coming to see you because what I love about you, Dr. Bates, is that you treat people. You've been in practice since 1999. You're obviously an active member of the Plano community, but you've served as chief of medicine at Medical Center of Plano.
City Plano.
Yeah, and you're also a speaker, which I can see why you would be an in-demand speaker. You're certified in internal medicine by the National Board of Medical Examiners, but you're also certified synergetics education, which is let's talk about that aging. Right?
Absolutely, yes. Age management medicine. I mean, managing as we age, things change. And again, a lot of it, the cornerstone is the diet, the exercise, supplements as appropriate, and then hormone balancing. Again, hormone optimization.
Right. And I love that. And the other thing is just fantastic. You are certified in medically supervised weight loss and bioidentical hormone replacement, pellet therapy. And you're working on your fellowship and certification in your anti-aging and regeneration of medicine, which I love. One of the things at the break that I discovered, because I used to always laugh at my mother about this, and I know it's not a laughing matter because it's real, is the urinary continence. Let's talk about that a little bit and what starts to happen in the aging process, particularly for women.
So anything from overactive bladder to literally incontinence is, I mean, it's massive. You know, it's 40% in our 40s, 50% of women in their 50s, 60% in their 60s, and so on. So the industry in itself, the incontinence pad industry and all of this stuff, it's billions of dollars sort of an industry. And there has actually been very, very little we can do. There's the sling surgeries and so forth. And there is some success with those, but the sling, they got a horrible story. There was some horrible things that happened. And a lot of people don't have a good result. Then there's the medication. A lot of side effects, constipation, dry mouth, et cetera.
And that's what I was going to say, because truly what the average person knows, it can only be treated that they know of with medication.
Yeah. So poor choices. So basically in around November of 2017, the FDA approved this absolutely brand new treatment, and we are one of the first in the DFW area to own this piece of equipment called an EMSELLA, EMSELLA. And basically it is just a chair. It is a chair that you sit in completely fully clothed. It is non-invasive, nothing like that. And the technology is what we call high FEM, which is high intensity.
It's electromagnetic.
Exactly, like
technology,
MRI.
Right.
And just sitting on this for 28 minutes is the equivalent of 12,000 Kegels. 12,000 Kegels. They say a urologist or a urogynecologist will tell you can't even effectively do one Kegel. So again, this is a 28-minute treatment. The full treatment is 6 of these treatments, 2 a week for 3 weeks.
Unbelievable.
Yeah, and we have a 96% rate of getting people off their medications, out of pads, and so forth.
That's fantastic, because I know, my mother, I would laugh at her about this, but her and her best friend would always say, wait till you get older, Kimberly, because it's going to happen. But I know so many women through my mom's friends that are taking the medication, and I know they don't know this is available. So this is just amazing.
Yeah, huge. It's a huge problem. People change their lifestyles. We were talking earlier about age management and so forth, and it's not just the number of years, but it's the quality of life.
Right.
This affects people's quality of life terrifically. They stop playing tennis. They stop running. They stop moving. They stop going to the mall, or they have to map out, they say, the bathrooms where
you have to know where the bathrooms are to be close to my mom had to do the same thing.
It's aging, it's weight. Weight can be a drain on it. It's gravity, it's having babies, it's all of those things. It's real life. It's pelvic floor muscles get more and more lax, and so this is what that does. It basically tightens up those pelvic floor muscles. And it's a miracle for people with this problem, really. We've had 100% of the people that we've had since we got this have been successful.
And you're one of only a couple in the Metroplex.
There's only 2 or 3.
Or maybe I'm even in the state. Maybe I wonder how many are in the state of Texas. Probably
there's definitely some in San Antonio as well.
Right.
but we are one of the very few
in the Dallas-Fort Worth area.
in the DFW market. Yeah, we've had tremendous success. We're very, very excited to be able to offer it now to our patients.
That's fantastic. And if you definitely need to check this out, guys, drbateswellness.com, and under what's new is where this is. Before we close out, if you could give one or two tips to someone about the holiday season. You know, I've heard people say, if you know that you're going to a party and there's a buffet, have a bowl of soup or a cup of soup before you go. Or make sure, sometimes they say hunger is masked because you're thirsty. Drink a cup of water instead. So with a few minutes left, give us a couple of your tips for the holiday seasons to kind of keep us in check.
So I completely agree with you. One of the first signs, so when you feel fatigued, often you're thirsty, so drink some water. When you feel hungry, you're thirsty, so drink some water. Just because, whether you don't think that you're hungry or thirsty, but just so you don't overeat, drink some water. And then, I would be very cautious about going anywhere starving. Don't go to
grocery store. I've learned that one. Don't go.
Yeah, that's exactly right. And then on another level, as far as staying well, consider, if it's appropriate, consider a flu shot. Some of the stats on flu are absolutely surprising, as how many people, hundreds of thousands of people died in the 2017-18 flu season. I was mortified. I just did a little bit of reading on that. So I would say that hand wash your hands. I mean, maybe if you're sick, think about staying home, right?
So many people don't stay home. It drives me nuts.
Yeah, I mean,
stay home.
Yeah, these are
and
very
I know
real
people
things.
get paid. I know it's hard, but it's hard to. You make other people sick. You truly do.
Sleep. Right. Maintain our sleep. We should be doing 7 to 8 hours of sleep. It's so difficult, but don't skip on sleep. Exercise. Don't skip on exercise. Try and stay in a routine as much as you can.
Right.
It works.
Right.
A lot of us are dealing with insomnia, falling asleep, staying asleep. But again, those routines really, really help.
Right. Well, I just have absolutely enjoyed our time together. Blown away by you. You're fantastic. And guys, I'm going to be letting all my girlfriends know about Dr. Rosemary Bates and her practice in Plano. So please be sure. I want to say thank you for coming in for the show.
Thank you so much for having me.
And please, please, please go to go to BatesWellnessCenter.com. And drbateswellness.com, guys. Check this out. And if your mom is going through this issue with the urinary incontinence, check it out. Welcome. Have a great holiday season. We'll be back, and we'll have you on it again in the future.
Thank you very much.